Body fluid compartments can be broadly categorized into intracellular fluid and extracellular fluid. This is the fluid contained in the spaces outside the cell. The extracellular fluid compartment includes plasma, interstitial fluid, and transcellular fluid. Plasma. It is the fluid portion of blood. It represents 25% of the extracellular fluid. Its volume can be calculated from the blood volume and packed cell volume. The plasma volume can be calculated using blood volume, where blood volume into 100 minus hematocrit divided by 100 gives the plasma volume, where blood volume is around 80 ml per kg of body weight. Interstitial fluid. It is the part of extracellular fluid that is outside the vascular system. It surrounds the cells, all the cells except blood cells, and includes liver. Transcellular fluid represents the fluid in the lumen of structures lined by epithelium. It includes digestive secretions, sweat, cerebrospinal fluid, pleuroperitoneal, synovial, intraocular, pericardial, bile, and luminal fluids of gut, thyroid, cochlea. Intracellular fluid. This is the fluid containing within the body cells. Its volume varies. If you see the total body water, 60% of the total weight it is made up of body water, and total body water can be, as we discussed, extracellular or intracellular fluid, and intracellular fluid is almost 40% of the total body weight, whereas extracellular fluid is 20% of the total body weight. And the extracellular fluid can again be divided into interstitial fluid and the plasma. So amongst 20%, the 3/4, that is 75%, is interstitial fluid and 25% is plasma. If the total body water is 42 liters in a 70 kg man, then 14 liters will be extracellular fluid and 28 liters will be intracellular fluid. In the 14 liters of extracellular fluid, almost 3/4, that is 10.5 liter, is interstitial fluid, and 1/4, that is 3.5 liters, is the plasma. Measurement of body fluids. The volume of water in each fluid compartment can be measured by the indicator dilution principle. It is based on the amount of substance injected intravenously, that is A, the volume in which that substance is distributed, that is V, and final concentration at it, that is C. So concentration can be given as the amount of substance that is injected divided by the volume in which it is distributed. So volume can be calculated using this formula, that is, it is the amount of substance injected divided by concentration of that particular substance. The dyes which are used, they should have a characters that they should be easy to measure, should be non-toxic, must mix evenly, must remain in a compartment which is being measured, must not alter the water distribution, must not be unchanged by the body. Extracellular fluid measurement. The ECF volume is difficult to measure as the limits of this space are ill-defined and few substances mix rapidly in all parts of the space, while the remaining are exclusively extracellular. The most accurate method to measure the ECF volume is by using inulin. As chloride is largely extracellular, radioisotope chloride have been used for determining extracellular fluid volume. Mannitol, sucrose also have been used. Plasma volume. It is measured by two dilution methods. First method employs the substance that neither leave the vascular system nor penetrate RBC, which is Evans blue, and radioiodinated human serum albumin, and also radioiodinated gamma globulin and fibrinogen. The second method is based on the fact that the radioisotopes of phosphorus, iron, and chromium penetrate and bind to RBC. Therefore, the red cell volume, that is the volume occupied by all the circulating RBC in the body, can be measured by injecting tagged RBC intravenously, and after mixing has occurred, measuring the fraction of RBCs that is tagged. Commonly used tag is chromium 51, that is attached to the cells by incubating them with chromium solution. So then plasma volume is equal to blood volume into 100 minus PCV divided by 100 gives the plasma volume. Interstitial fluid volume. It cannot be measured directly because as it is difficult to sample and no substance is distributed exclusively in this compartment. The interstitial fluid volume is determined as the difference between the extracellular fluid volume and plasma volume. Intracellular fluid compartment measurement. Intracellular fluid cannot be measured directly by dilution because no substance is confined exclusively to this compartment after intravenous administration, and it is determined indirectly as intracellular fluid volume is equal to total body water and extracellular fluid volume. Total body water can be measured by indicator dilution principle. Deuterium oxide, that is heavy water, has a properties that are slightly different from water, but in equilibration experiments for measuring total blood volume, it gives accurate results. Tritium oxide and aminopyrin or antipyrin have also been used in the measure total